Good morning, everyone, and welcome to the Northwest Communities for Climate Action Conference. My name is Angela Andrews, and I'll be your MC for the next 2 days. I'd like to start our conference by inviting you to join me in acknowledging First Peoples and their connection to country. In Australia, this connection has been maintained for more than 60,000 years. It exists today and extends into the future. Of course, we're all streaming into this online conference, and many of us are dialing in from our homes and our offices located on the lands of the Wurundjeri Woi-wurrung and Boonwurrung people of the Kulin Nations. And a big special hello to all staff from our community organisations. As for me, I'm zooming in from home today on the lands of the Yalukit Willam clan of the Boonwurrung people. And wherever you happen to be this morning, I do invite you to join me in acknowledging the elders and ancestors of country on which we live, work and play, to pay our respects to elders past and present, and to recognise and celebrate the diversity of Aboriginal peoples and their ongoing cultures and connections to the lands and waters of this continent. In a moment, I'll be introducing traditional owner, Uncle Colin Hunter, who'll be providing a formal welcome to country. But before I do so, there are a few quick things that I'd like to tell you about in terms of how things will be proceeding today and tomorrow. My role as MC will be to keep us on track, to give us context and to be providing some background for each of the sessions, as well as facilitating some of the sessions as well. Now, for those who perhaps I haven't met you before, I am the immediate past president of an organisation called Environment Education Victoria, and I'm incredibly passionate about the environment and I'm very passionate about community. Now, this is the first time an event of this kind has taken place. It's a very special collaboration between 6 councils in Melbourne's north and west metropolitan areas. It's been led by Hume City Council with Moreland, Whittlesea, Brimbank, Maribyrnong and Moonee Valley as partners. Now together these 6 councils represent almost 1.2 million people. And as organisations, these councils are taking all sorts of actions to reduce emissions and to help prevent the worst impacts of climate change. For example, Moreland, Moonee Valley, Maribyrnong and Brimbank have declared a climate emergency. Whittlesea has pledged to become a net zero emissions organisation by 2022, and Hume has a 100% renewable energy powering all its buildings, and it's helping householders to do the same. Now, we need action on climate change now more than ever. The bushfires of 2019-2020 created trauma, disruption, ecological destruction, and damage to health on a scale that has not been seen before in this country. And as a result, communities have responded by becoming closer, developing their connections, and working out ways to adapt. Over the next 2 days, we will hear about the latest strategies and techniques by community groups, traditional owner groups, and others to take action on climate change and to help strengthen our communities to be prepared for unprecedented weather events and other impacts of climate change. And I'm sure you'll find it to be a very interesting conference. I also need to let you know that this conference is being recorded and selected sessions may be published in the public domain. Now, due to the high number of people who are participating, our technical producer, Andrew, will be switching off everyone's cameras and microphones to ensure that we're able to spotlight our attention on our special guest speakers and presenters. During some of the sessions, when we move to smaller breakout rooms, you'll be invited to switch on your cameras and microphones in order to be able to fully participate, connect and engage with others. And remember that you can also go up to the top right-hand corner of your screen and switch between gallery view, where everyone can be seen all at once, and speaker view, which enables you just to spotlight your attention on the speaker. Now, of course, at the same time, you are still able to communicate by everyone in the conference by typing in comments in the chat box, and that chat box icon is located on the bottom of your screen. You can also touch base with Andrew if you're having any technical difficulties. You can ask questions of me as the MC, and you can also share your thoughts, your reflections and comments with everybody else too. Now, because there are so many of us here today, you may also wish to let everyone know who you are by updating your participant name to include some details about whether you're from a community organisation or whether you're representing a local community group. And you can see that I've made these changes for our conference, and you can see that, for example, I've indicated that I'm the MC. Now, remember that if you're having any technical difficulties over the next 2 days, please just pop a message in the chat and our technical producer will be on hand to assist you. Okay, I think that's it from me for now. And so now I'm incredibly honoured to introduce to you Wurundjeri Woi-wurrung traditional owner, Uncle Colin Hunt Jr. Thank you so much, Uncle Colin, for that stirring welcome. In a moment, I'm going to be introducing Sally MacAdams, who's the project officer at NAGA, the Northern Alliance for Greenhouse Action. And Sally will be facilitating today's main session. But before I introduce Sal, I want to briefly explain that the focus of today's session is on the community sector, for community service organisations, health organisations, and community members who are keen to understand more about how community services can help build resilience to climate change. Today's session will be wrapping up at 12:30. We did also originally plan to have a schools stream running alongside us today, but this has of course been postponed due to the COVID restrictions that are currently in place here in Melbourne. And so if you did register for the school stream, you'll also be receiving a notification about a rescheduled date. I also wanted to let you know that if you've only registered for today's session of the conference, I do encourage you to think about registering for tomorrow as well. And you can do this by clicking on the link that Andrew will be posting into the group chat for us. Tomorrow morning, as part of the conference, we're going to start the day by hearing a very special keynote address by Professor Bruce Pascoe, who's the author of Dark Emu. And this will be followed by a day of discussion and films on a range of topics, including First Nations knowledge and perspectives on climate change, including the role of Indigenous cultural burning in order to help prevent damaging bushfires. We're also going to be learning about how to volunteer and what you can do to help during an emergency. And we'll also be learning about some local climate action groups and how you can get involved. So please do consider joining us again tomorrow. And so now I'd like to introduce Sally MacAdams. Sally is part of NAGA, which is a network of 9 councils in Melbourne's north, working together to create a zero carbon society and provide maximum protection against the impacts of climate change. Sally has a background in community empowerment for sustainability. One of Sally's main responsibilities is coordinating the state government funded Exploring Vulnerabilities program. And this program helps community organisations, community health groups and businesses to help vulnerable community members and the general public to get prepared for the impacts of climate change, including things such as heat waves, bushfires, thunderstorms and asthma and smoke events. Sally, I know that you have an incredible lineup of speakers today, as well as some detailed scenario planning to explore. So I'll now hand over to you to get this session underway.
Thanks so much, Ange. Really great to be here, and thank you to you, to the conference organisers, and thank you to Uncle Colin for such a generous welcome this morning. So as Ange mentioned, this particular workshop is called Exploring Vulnerabilities, and it is for community sector workers, for council workers, and anybody really who's working with at-risk communities who are dealing with climate change. In case you've just joined us and you've missed it earlier, if you wouldn't mind changing your Zoom profile name to show your name and organisation so we know who you are, and mention anything that you'd like to about yourself there or in the chat. Thanks, Andrew. Let's go to the next slide. So I'd like to also start by acknowledging country. So I'd like to acknowledge that I'm on Wurundjeri country today, and acknowledge them as the traditional owners of the land on which we work, and that their sovereignty has never been ceded. I'd like to pay my respect to their elders past, present and emerging, and recognise that they've looked after country and climate for millennia. And also, as mentioned earlier, if anybody would like to mention the land that they are on, if they're not from Wurundjeri country, please do that in the chat. Thanks, Andrew. So a few introductions. So as Angela mentioned, my name's Sally MacAdams. I'm from the Northern Alliance for Greenhouse Action, also known as NAGA, and I have a cast of thousands with me today. I've got some breakout facilitators helping out today who very kindly offered their services. We've got Ben Latham from VCOSS, Ellie Hall from Banyule City Council, Heather Lawson and Georgia Langmaid from Enliven, Jack Piper from Jesuit Social Services Centre for Just Places, Joe Burton and Sushant Gurung from Hume City Council. Thanks, Andrew. And I'm also really excited that we've got a fantastic panel of presenters today as well. So we've got some expert practitioners and researchers from the field who are going to share their experiences and their learnings. We have Susie Maloney from Jesuit Social Services Centre for Just Places. She's going to be speaking about the Hotspots initiative. And we have Nuruddin Hassan from IPC Health Brimbank, one of the participants in Hotspots. And he's going to be talking about how his organisation's been talking to the community about climate change impacts on health. Heather and Georgia from Enliven are going to be talking about food security and their climate change audit tool and some other climate change initiatives. Then we'll have Kay Graves from Bendigo Community Health Services, and she's going to be talking about a really important topic about supporting newly arrived communities to adapt to Melbourne's changing climate. And finally, we'll have Edgar Caballero from Banksia Gardens Community Services talking about their programs around youth leaders in the climate movement and their aspirations around heat havens and other outreach. Thanks, Andrew. So we're actually running a little bit of ahead of time today, which is great. So we may get out just a little bit before 12:30, but just so you know, we will be aiming to have a tea break around the sort of 11:15 to 11:30 mark, depending on how things go. But we're going to start off with some predicted impacts on communities and organisations, particularly for those of you who maybe aren't so across what particular climate impacts are presenting particular challenges for at-risk communities. And then, as I said, we'll have presentations from our panel of presenters. We'll have some breakout groups where you'll get a chance to actually talk, not exactly face-to-face, but in a small group with our presenters and really delve into their insights a bit further. We'll do some scenario planning, as mentioned earlier, which is going to give you a chance to think through how you would respond, for example, in an extreme weather event or another climate event. And we'll have a little bit of time as well for reflections and some planning and networking before we wrap up. Thanks, Andrew. And so just before I get into the climate impacts, I also wanted to acknowledge that this workshop is partly based on a project that Ange mentioned called Exploring Vulnerabilities, and that's been supported by the Victorian Government as part of Melbourne's climate journey, and it's been contributing to the regional adaptation strategy for all of Greater Melbourne. Thanks, Andrew. All right, so just to get into some of the current and predicted climate change impacts, and really important to note that word current, that climate change is now, it's not something that's only going to happen in the future, it's something that's already happened and we're experiencing it right now as well. So it has been projected that Melbourne is going to continue to get hotter and drier, and we're going to be experiencing more storms, fires, floods, droughts, and even significant sea level rise. So one of the ways that this has been characterised is that Melbourne will essentially be more like Wangaratta is today by around the middle of the century if we don't get on track with our emissions reductions. We know that the average temperatures in Victoria have already increased by more than 1 degree over the last century, and the fire danger period has become longer. But we're looking at further impacts like even longer fire seasons with up to 60% more very high fire danger days. Average annual temperature increases up to 2.4 degrees, which is really significant. Double the number of very hot days. Sea levels may rise to up to around 24 centimetres. There'll be more intense downpours, and regular rain in the cool season is going to decrease, as is snowfall. So all of this adds up to quite significant changes to our climate on top of the ones that we've already experienced. Thanks, Andrew. So I don't have time today to go into heaps of detail or go down to a smaller regional level, but if you want to find out about that, I'm sure that Liz will be able to distribute the slideshow later on, and you can have a look at these web links where you can go and see some quite detailed data about the changes that we're expecting. Thanks, Andrew. And so before we get onto our panel of presenters, I also just wanted to give a little bit more context. Many of you will be working in the community sector, or in councils, or in schools, or a whole number of settings, maybe as volunteers, in communities where there are specific groups that are disproportionately impacted by climate change, and that's not always visible, not always obvious. So I just wanted to highlight a few of these particular at-risk communities and what are the specific impacts and challenges that they're facing. And that's challenges in terms of the risks themselves, and also the barriers to actually coping with or adapting to those impacts. So the first one that I wanted to highlight was people with disabilities. People with disabilities are more likely to be on a low income, and you'll notice that's a common theme across all of these at-risk communities. They're at greater risk of harm during disasters. And at the same time, emergency management and relief may not adequately address their needs and disability access. They're heavily impacted by extreme weather, and extreme weather and disasters can also affect medication, which oftentimes people with disabilities are reliant on. They're also reliant on a regulated environment and a reliable supply of electricity, which may not be reliable during disasters. They also tend to be less likely to be mobile, or they may lack independent transport. And public transport, as we know, is often impacted by extreme weather, whether that's just hot days or blackouts or disasters. They're more likely to experience communication barriers. They also experience ableism and misconceptions about what their needs might be. And they're more reliant on others for everyday needs and activities. Thanks, Andrew. The second group that I wanted to highlight is newly arrived asylum seekers and refugees, and we're going to hear a whole lot more about this from Kay later on. She's going to tell us a little bit about the experience of Bendigo Community Health in working with these communities in terms of climate change impacts. But I'll just touch on some of the impacts for them. So again, they're more likely to be on a low income. They also have more limited social networks in Melbourne when they're new. They're more likely to have low proficiency in spoken or written English or even other languages, more likely to have limited access to digital communications or low digital literacy. And oftentimes they're coping with trauma and associated psychological, cognitive and learning impacts, coping with anxiety and depression related to settling a new country with limited support. They can often be reliant on family members or other service providers for everyday needs and for access to social and technological systems, or they're acting themselves as an interpreter for other family members. They may also have little familiarity with Melbourne's climate, and they may bring assumptions from their home country that don't hold true here. They may not know how to swim, for example. They may have low public health literacy. And again, oftentimes emergency management systems haven't thought about their different ways of working in terms of accommodating their needs. Thanks, Andrew. And the last group that I wanted to highlight today, and that's not because it's the only group, there are lots of at-risk communities, but I just wanted to highlight a few that are particularly prominent. And the last one's older people. Again, more likely to be on a low income, more likely to live alone and be socially isolated, which is a really big barrier. They're more likely to have a disability or a communication barrier. Again, less likely to be mobile, and they may lack independent transport. They may be reliant on others for everyday needs. Oftentimes they're reluctant to use air conditioning or fans because they're worried about high energy bills. They may not have a lot of control over their living environment. They may be afraid to leave doors and windows open at night to cool down, and they may not feel comfortable accessing public cooler places. Thanks, Andrew. So I wanted to just highlight those so that you've got in the back of your mind that the kinds of specific issues that might be kind of hidden in your communities, or you might be very familiar with them, you might experience them yourself, or you might be working with communities who are experiencing all of those barriers. But I wanted to also just quickly highlight some of the ways in which government organisations, not-for-profit organisations, and society at large, including community groups themselves, are trying to address some of these impacts and gaps. So on the individual level, that is sort of targeting individual people, families, households, there's quite a lot of communication campaigns out there trying to help individuals prepare for extreme weather. We'll hear more about that from some of our presenters today. We also have some in-home solutions like home retrofit, so that's weatherproofing, solar systems, insulation, that kind of thing. We also have some check-in systems, so oftentimes local governments and not-for-profit organisations will have a register of vulnerable people and they check in with them on, for example, really hot days to make sure they're okay. At the community level, we have both community organisations and groups and local governments, for example, providing cooler places. So that's places like libraries or a clubhouse or community centre, neighbourhood house, where you can go to just get cool when it's really hot. Check on your neighbour campaigns that encourage people to actually kind of take some ownership over their own community and check on people who are might be struggling in the heat or other disasters. There's also community training and peer-to-peer communication. So that's, getting communities to kind of spread messages among themselves. And grants for community groups, which are great at enabling groups to actually look after their own needs and come up with their own ideas. At the organisational level, councils and community sector organisations are doing training, they're doing risk assessments, and they're creating policies and procedures, and that's all around helping not just their own organisations to adapt to climate change, but also to be able to support those at-risk communities and the communities at large in which they work. And at the bigger picture level, we have state government policies like the Victorian Health Policy. We have regional adaptation planning, like I mentioned, this project has contributed to. We have state government funding programs, and a really important one is things like the recently announced improved standards and upgrades for social housing, because again, they're an at-risk community where normally they don't have a lot of control over their living environment, and so are dependent on the state actually stepping in and improving things. Thanks, Andrew. So we're ready to hand over to our panel of presenters. So we're going to have 5 presenters, and I'll keep my mic on and I'll give you a 2-minute warning when you're getting close. But yeah, I'm going to hand over now to Susie Maloney from Jesuit Social Services. She's going to talk about the Hotspots initiative. So over to you, Susie.
Hi, everyone. And Sally, thanks very much for the introduction. It's surprising to be ahead of time in these things, so well done, everybody. I just wanted to introduce myself. So I'm Executive Director of a new initiative that Jesuit Social Services has established. So I started with the organisation this year, leading an initiative called the Centre for Just Places that focuses on research, action and advocacy around addressing social, economic and environmental inequalities in place. And so the issues that we're talking about today really are central to the work that we're doing. Prior to my role here, I was at RMIT doing research in urban planning, sustainability and climate change, and working with a range of local governments and community service organisations, particularly looking at climate change adaptation. So I'm going to talk a bit about the work I did in my previous role and also in the work that I'm doing now. Thanks, Andrew. I'd also just like to acknowledge the traditional custodians of the unceded lands we are meeting on today, and pay respects to elders past, present and emerging. And thank you to Uncle Colin Hunter for the really warm welcome today too. Thank you. Thanks, Andrew. So as I said, I'm speaking about some work that I was involved in when I was at RMIT in the Centre for Urban Research. And this is with Karen Bosworth and Heidi Gooder, who were part of the team. So I'm going to talk about two pieces of work that we did around the Hotspots initiative. We've got a few of the Hotspots teams here today, so they'll be telling you more about the work they're doing on the ground. But our work was to develop a literature review and also produce an evaluation of that work. And there's two reports that you can access, and I can certainly provide that to Sally for her to share after the workshop. So if we could just move to the next slide, Andrew. So just quickly to tell you a bit about Hotspots. So this is an initiative funded by and created by the Lord Mayor's Charitable Foundation. And they funded three key organisations: IPC Health in Brimbank, Enliven Primary Care Partnership in Dandenong, and Co-Health working in the Carlton and Flemington public housing flats in inner Melbourne. And so each of these organisations formed a cross-sectoral collaborative group, and you can see the list of organisations that they worked with in these hotspots initiatives over the last couple of years, and they're continuing to do this work. So what I'm just going to present on in the next couple of slides is just some of the findings that we found from the literature review and some of the evaluation results from that project. So if you can move to the next slide, Andrew. So just to explain, the lit review was to look at effective and adaptable place-based approaches to responding to urban heat. That was one aspect of what we were focusing on, and the second part was looking at heat health plans and interventions and community-based initiatives to reduce heatwave impacts. So that was the focus of the lit review. So just some key findings to run through quickly with you. So first of all, I think, some of these points are going to echo some of what Sally has covered already. So it's just to sort of reinforce how we understand heat and that heat will impact places and people differently, and the impacts are uneven. And we also know that that those most disadvantaged or socially marginalised will be most impacted, as Sally has pointed out. The second part about heatwave experiences and responses is that they are place-based, and by that we mean that the experience and also the definition of heat waves varies from country to country, region to region, and locality to locality. And so that means that heat health plans and alerts do differ in different contexts. And also how we experience heat ourselves depends on a range of factors that can be place-specific. And that relates to the next point about vulnerability. And that vulnerability is not a fixed concept, or it's quite fluid. It can change, and it needs to be constantly reassessed and reevaluated. So while we are all vulnerable to extreme heat, some people are much more vulnerable due to their levels of exposure, their socio-economic or political context, or the systemic structures that actually create vulnerabilities. So poor quality housing, for example, lack of cooling options or affordability of cooling options, and lack of access to green spaces are some of the issues that contribute to vulnerability. But other factors that also contribute to how vulnerable or resilient we might be can include other factors, other things like social or community cohesion, social support structures, access to information and health services, education, financial situation, health status, and mobility and lived environment. And when we think about all of those elements, we recognise the multi-sectoral response then that's required to address vulnerability and the drivers of vulnerability. And just the final point there about heat health communication. Again, Sally pointed out the diversity of communities that can be more impacted by heat. And that then means that we need to develop heat health communication that is culturally contextual and reflective of different community needs and issues. Next slide, Andrew. Just a couple more points to finish on with the lit review work. So again, heat health plans then need to reflect diversity. That's a really important point, and be in dialogue with communities and be reassessed frequently. The second point there is that health and social outreach organisations, and many of whom are in this conference today, they need to be at the forefront of implementation of plans and programs, and that's because of their capacity to tailor programs to meet the needs of the different communities that they're working with. And again, it's not to transfer responsibility or overburden organizations that are already challenged with carrying a lot of responsibility, but it's really important to point out for a range of other organizations, national and state governments, that often responsibility will land at the door of health and community organizations who will need the support to develop and implement and adapt these plans. And finally, a range of government and community service sector responses emphasize the importance of co-design, and this really comes through from the literature and international experience, the importance of co-design of strategies and responding to locality. So top-down approaches can work in some cases around some aspects of emergency management, for example, but really co-design, working with community, listening to community is really important part of this work. Next slide, Andrew. This slide here just reflects on some of the lived experiences that came from the hotspots engagement. And these comments on the screen come from those working across the 3 different organizations and the conversations that they had with those that they were working with. One of the things that we did as part of the evaluation was to try and capture the lived experience. And this is a really key point that comes from the research as well, is that we really need to understand how heat impacts people, how they feel it, the visceral effects of heat. And these comments here really do illustrate some of those points. The third point there about one resident spoke of feeling like he and his wife were trapped as they could not go anywhere during hot days. That sense of being trapped and having little control over your context was really a strong theme. She said it is like she's inside an oven and the walls are very hot. She doesn't sleep well during the night because the walls get so hot. She's a healthy person, but mentioned during hot days, it really slows her down and makes her feel weak. So the impact of heat is bodily, it's experienced, and it impacts so many aspects of our capacity to live and function effectively. And the last point really does get to the challenge of people's lack of choice. When asked if he has any other ideas of how others in the building can reduce impact of heat, he said, go live elsewhere. The next slide, Andrew. And so sort of picking up on some of those kinds of messages that came from the hotspots work and the experiences of people on the ground. One of the things, and Sally sort of picked up on some of these points, is that while the provision of fans and air conditioning helps to address the immediate impacts of heat waves, and not everyone has fans and air conditioning just to begin with, but it is clear that more work is needed to address the systemic drivers of vulnerability. That's a really key point in this work. So that the financial cost, for example, if you have an air conditioner, the financial cost of running air conditioning might see this risk management action, and it's most often the default response in these programs is to say, turn on the air conditioner, but this can make some people more vulnerable to other impacts such as food or housing insecurity, for example. In addition, poor housing quality and construction, for example, a lack of insulation can make air conditioners less efficient and even more expensive to run. So there's some compounding effects there. And these impacts indicate an important role for initiatives like hotspots, but place-based collaborative work is really the point. That's what's needed to help advocate and support the drivers of vulnerability that are specific to communities and contexts that organisations work with. Next slide. Thanks.
And Susie, 2 minutes to go.
Okay, so this is the last slide just on the evaluation points, and really it's sort of reiterating, I guess, the systemic dimensions of addressing heat. And while there are immediate responses to addressing risk, so it's important, I think, to understand what we mean by risk as being driven by the hazard, which is heat, but a person's exposure is a key factor. The exposure to that hazard is really important, and that points to housing, urban greening and so on, and the provision of health services. These are just, again, some other points, and one of the key, I think, themes that came from the message from the evaluation was that there was a sense that people just don't care. And I think a lot of these conferences and discussions we're having now are really important because it's about standing up and addressing that point that people do care and that we can do something. Just the last couple of slides, Andrew, the next one, please. So I just wanted to mention the work that's kind of continuing now at the moment. So Jesuit Social Services led some work last year together with VCOSS and RMIT, and I was part of that work when I was wearing my RMIT hat. And we co-designed training and engagement with community service organisations that we ran with Brimbank and Dandenong. And we're continuing that now as part of our work at the Centre for Just Places. And we're working with various local governments at the moment, including Darebin, Yarra, Mornington and Dandenong. And that's really to bridge the relationship between community service organisations and local governments. And the fact that climate change is now included as one of the top 4 risks in the health and wellbeing strategy for the state, this is really driving a lot of work in local governments. And there's a real recognition across local governments that they need to understand quite clearly the how climate change is impacting health and wellbeing. Just the last slide, thanks, Andrew. So really, it's just to sort of highlight that in these workshops, we're seeing community service organisations really understanding they need to embed climate change in everything that they do, personally and professionally, that they're making the connections between a range of stressors like COVID, economic downturns and climate change impacts, and that these compound and exacerbate social inequalities. So there's a real recognition, I think, across the sector about the underlying structural drivers that really have to be addressed when we talk about climate change adaptation and building resilience in communities. So that's it, Sally.
Thank you so much, Susie. That was really fantastic. So great to get all those insights from that amazing piece of research. And actually, one of the organisations featured in that research, IPC Health in Brimbank, is going to be presenting next. And Nuruddin Hassan is going to present for us. Thanks, Nuruddin.
Hi, good morning, everyone. My name is Nuruddin, Community Development Officer at IPC Health. And today I'm going to talk a little bit about the project as it is being implemented in the Brimbank area. So over the past 2 years, IPC Health, in partnership with Brimbank City Council and other local stakeholders, has been implementing the Hotspots program. I should also say that we do refer to the program as the Keep Cool campaign from time to time. So it is the same program. And the aim really is to raise the profile of the impacts of extreme heat on health and the need for a community-wide response. And as we've heard already, and we'll probably hear throughout the duration of the conference, that extreme heat events are increasing in intensity and frequency, and this does pose a significant implication for health and can exacerbate a range of pre-existing medical conditions. Certain population groups have increased vulnerability to the harms of extreme heat. And this is certainly an area in which we've deepened our own understanding as a result of this project. And so these groups, as noted before, include older adults aged 65 and above, cold community groups, children, those individuals with chronic health issues, community members where English proficiency is low, and those of socioeconomic disadvantage. The Hotspots program is being implemented in the Brimbank area with a focus on a geographical heat hotspot, namely around St. Albans, Kings Park, Sunshine and Deer Park. Next slide, Andrew. So the aim of the program for us really was to try and increase awareness and to support stakeholders to prepare and respond to extreme heat events, and also looking at supporting community resilience to the effects of heat waves. And so this has been one of the priority areas, and it largely includes engagement with at-risk population groups to try and look at what vulnerability looks like for them specifically and what solutions could possibly look like as well. So we've tried to, wherever possible, adopt a community development approach to implementing this project. We're also looking at supporting community-led responses that would help to increase capacity. This is an ongoing area of work for us. At the moment, I think the awareness raising component of the program is probably taking precedence, but we hope to land at a point where we're working with community groups as well to try and support them to lead their own response. Next slide, Andrew. Just to give you a bit of a timeline over the last couple of years and some of the things that we've been working on. So, you know, we've engaged with community members in Brimbank through a number of projects and initiatives, and some of those are listed on the slide deck here, and predominantly through information sessions, forums, workshops, through a media event in 2019, working with Croaky Go, and a series of online events as well. And all of these events, you know, have been able to identify some common themes, issues, and needs as experienced by the community when thinking about what planning and response looks like when it comes to heat waves. And so I'm just going to delve a little bit into some of those areas in the next set of slides, Andrew. So one of the main themes that we've noticed and continues to be a recurring theme, I suppose, is that there's a real lack of shared understanding in terms of what is a heat wave, and in more particular terms, what constitutes one. And so, you know, more importantly, looking at how extreme heat events impacts on health, having a shared understanding around what constitutes a heat wave will support us to try and achieve that. And then also misconceptions also vary across different community groups, organizations and individuals. And people that we spoke to were often surprised just by how much of an impact heat can have on their health and on their well-being. And our information sessions that we've delivered help to give people some basic indicators around which they can begin to think about planning, and also when needed to look at activating a response strategy. When discussing heat in the community more generally, it's often evident that there are multiple vulnerabilities, and I think they've been shared earlier by Susie and others as well. And at the same time, I guess for us, heat vulnerability doesn't just occur in a silo, so really emphasizing that once again. So for example, the cost of keeping cool during summer has been a common theme that many community members have identified, and in a lot of ways is exacerbated by other individual circumstances, such as, you know, a person's socioeconomic status, by environmental factors such as investments in urban design, the geography of the local area, and its heat island effects, as in the case for Brimbank. One of the other emerging themes, I guess, for us is that we often have a very short window in which to try and deliver programs like these. And so one of the biggest challenges we have is that we're trying to roll out and implement the program in a very short period of time, and we quickly start moving into other seasons within the year, and it makes it really difficult to talk about hot weather and the impacts of heat outside of those specific periods. Now, in terms of the impacts of heat on health, I'll just go to the next slide, Andrew. What we're starting, sorry, not starting, but what we're seeing, I suppose, is that older people, parents of young children, are reporting back to us that they're staying indoors to keep cool more often. And so there's a real impact on mental health and feelings of isolation. It presents challenges to their normal routine. There's limited connection to family and friends. On many instances, when doing our information sessions and talking to community members about what they do in terms of staying connected to family and friends, we're hearing that that's not happening, that they are not reaching out to others, and by the same token as well, others are not necessarily reaching out to them as well, and that there's limited supports for them locally if they do need it. And so part of our campaign also looks at how we might be able to link them into local support services so that they're not in trouble or in an at-risk situation. One of the other things that we've noticed is that primary school age children have by and large demonstrated good knowledge of how to keep cool in summer, and we would attribute that largely to the Slip Slop campaign, and that schools being really proactive around that space as well. For young people, in particular, I suppose this applies to 12 to 25 in that age group that a lot of councils deem as youth. In Brimbank, we were hearing from youth services that there was a culture of move on that impacts on young people. So there were limited options locally for where young people could access cool spaces and be with their friends. So whenever a group would get together, and young people being young people, that more often than not, they were being encouraged to move on from that particular space. And so that was a bit of a challenge and a concern that we were seeing as well. So we've begun some work with Brimbank's Youth Services to look at an awareness raising campaign around that more broadly. Next slide, Andrew. So in terms of community needs, and just to give an example of some of the practical needs that we've identified and are working towards. So we've identified, I guess, and recognized the potential value of having cool spaces in the community that can be accessed to seek relief from hot weather in the lead up to summer 2021. So this will be one of our key considerations for the project, and we hope to be able to support community in leading some of this initiative and others like that as well, where we have a big emphasis on supporting access to cool spaces. Community groups and individuals don't necessarily have their own action plans to respond to heat waves. So this is an area in which we're also looking to do some work. We're also looking to continue our support for local service providers who engage with vulnerable groups to play a greater role in supporting planning and response when it comes to extreme heat events. So one example that we refer to quite a bit because it's very applicable to us is a health service, for example. When extreme heat events are declared, or it's a day where it's above normal average temperatures and it's very risky for community members to travel into our service, we're often making phone calls to cancel or reschedule appointments. And so in that process, we're having conversations with teams about also undergoing a bit of a checklist with the client that they're speaking to about their living arrangements and any supports that they might need as well. So that's just a little example of what we're trying to do in that space. I guess that's the main thing that I wanted to share. Next slide, Andrew, sorry. So for us, really the takeaway is that we are adopting a community development approach to this. We're very iterative in our design and approach to this campaign. It's very much informed by community conversations that we're having through information sessions and a whole range of other consultation platforms. And I suppose for anyone looking at implementing something similar, we would encourage that approach. We would also encourage building collaborative relationships because we feel those are really central to try and achieve a positive outcome locally. Thanks, Andrew.
Fantastic. Thank you so much, Nuruddin. That was really great, and loved hearing about how you really targeted those specific things that you found out that those communities were experiencing through all of that consultation, as you said, over quite some time. So yeah, that was fantastic. Thank you so much. Next up, we have Heather and Georgia from Enliven. So that's Heather Lawson and Georgia Langmaid, and yeah, Enliven's been doing heaps of amazing work in this space for a long time. So let's hear from them now.
Thank you, Sally. Now, Enliven is a primary care partnership and also a health promoting charity in the southeast of Melbourne. And I think we realised early on that our member agencies were working with people who were most vulnerable to climate change, and it's an area that we needed to support them in. Next slide, please, Andrew. And one of the things that we did was develop a book, Climate Change Adaptation. Now, this was back in 2013, but it's still really very relevant today because it's for health and social services. And it looks at how to respond to climate change and also its impacts on communities. And it is available if people are wanting to have a look through it and read it. Next slide, please, Andrew. Some of the activities we've undertaken have been very hands-on and practical resources, like developing a flood list and green tips for organisations to make sure that they're doing whatever they can to minimise their emissions, and also working with people with disability and their carers to really look at what were the things that impacted on them through climate change. Climate change and violence poster. We all know that in very hot weather, unfortunately, violence increases. And so that was something that we presented at a conference. And looking at climate change and vulnerable groups in a literature review. So all these resources are available on our website. And the other thing that we've done more recently is working using group model building. And agencies came up with the view that firstly, they had to get climate change prioritised, because often the workers on the ground really saw that this was an important aspect, but to get it up right through your organisation and to have it as a priority across the whole organisation was quite a challenge. So that was something that they wanted to do, and they wanted data to really support the argument that they had to get that embedded in their agency. And also, as we've learned through COVID, creating positive messages shaped by the community. It's really so important that the message is something that's very relevant to each individual community. There's no one size fits all, as we've learned so alarmingly during the COVID period. It has to be something that is really relevant and uses the media that is most relevant to that particular community. Next slide, please, Andrew. Hotspots. We've heard a bit about hotspots, and I just endorse all the sort of things that Nuruddin was saying. During 2018-19 summer, we had the Dandenong heatwave hotspots project, and that was really focused on Dandenong and Brimbank. And in our particular area, it was because there was an increase in ambulance call-outs and emergency presentation at hospital for heat-related illness. And so Dandenong and Brimbank were seen as hotspots that needed some work to support the community to understand the impact of heat waves. And we've been fortunate that DELP has funded that expansion to the southeast. So we can now cover the 3 local government areas that Enliven is supporting. Next slide, please. Now, one of the things that I think is very useful for agencies, community and health organisations is an audit tool that we developed. And the audit tool was really developed so that there's just that consistency of standard of climate change adaptation practice. And it's something that we developed back in 2013, but with our work with NAGA, we have updated it, and it's really now a very useful tool for agencies to use to say, well, where are we at? What stage are we in this climate change process, and what can we do to improve our approach? And also, to the beauty of it is you can link it with your quality assurance systems. And that is something that's a real positive for you, because it can be helpful in thinking about the next steps that you need to take and where you are along the process. In some things you may not have even thought about it, and in others you may have achieved it. And it's good to just look through and think, well, all right, we can tick that one off. We've already done that. So I think this is something that will be useful to all organisations in the work that they're doing. Next slide, please. And these are the areas that it covers. So it looks at leadership, like, is climate change really integral to the whole organisation? And is it integrated? Like, it's not just one particular unit within an organisation, but it's the whole organisation that's working together. And the workforce, like, we talk about our clients, but what about our volunteers also? They're really important to be supported and understand what to do in the event of heatwave or extreme weather events. And how's your service delivery? Can you maintain it if the power goes out? What do you do? Thinking about all these things. So the criterion that the audit looks at covers all of these. And then the most important one, of course, is looking at and considering your at-risk communities and involving them in everything that you're doing in developing the audit and the work that will support you in climate change response. it's something that I think you'll find quite useful and helpful for your organisation to undertake. And we're very willing to share it with anyone who would like to use it. Next slide, and I'm going to hand over to Georgia.
And Georgia, there's 2 minutes left to go. Okay, thank you. Hi, everyone. So I'm the Health Promotion Officer at Enliven. So part of our health promotion team, we're currently running a social marketing campaign called Food from Home, and it's all about promoting the climate and health co-benefits of edible gardening. And this was, I guess, born last year during COVID and the rise in popularity of edible gardening. So it was launched last year in November and is still running. And we co-designed it and co-developed it with digital agency and various community members. And it reduces barriers to edible gardening, which was time, knowledge, space, and cost. So the campaign components, there's a few, but it includes an Instagram, Facebook, or website, a free seed initiative where we give out or distribute free seeds in which we've partnered with Casey Cardinia Libraries and Greater Dandenong Libraries. We provide free beginner-friendly resources and step-by-step guides, all about edible gardening and the climate and health co-benefits of it. We feature, written pieces and videos of local community members and sharing the reasons why they, have an edible garden. We also have a community garden directory, so we're really wanting to promote community gardens and school gardens. And so we're just helping facilitate the movement of edible gardening across Melbourne Southeast. So the community garden directory is actually going to launch in a couple of weeks, hopefully after lockdown ends, so people can go out. And we're promoting events and any other initiatives in the region around sustainability, gardening, food, everything like that. And future projects we've got lined up can include local seed libraries, edible garden trails, showcasing people's backyard and front yard gardens, workshops and translations. So it's a growing project, and if you want to know more or get involved, feel free to email me or go to our website and learn more there. That's all. Thank you.
Fantastic. Thank you so much, Georgia and Heather. Enliven's been doing some amazing work over quite a period of time. So really, really great to hear from you and see that it's been evolving recently. So our next speaker is Kay Graves from Bendigo Community Health Services. And Andrew, I'll just ask you to leave me on video as well, because Kay and I are going to do this as a little bit of a Q&A session. So Kay, you've been doing some amazing work in this area, and I wondered if you might like to start off, just for those people who don't know, just letting us know who are the refugee communities that have settled around Bendigo.
Thank you, Sally. Just before I answer that question, I'd just like to acknowledge the very warm welcome from Uncle Colin, and for the previous speakers, including yourself, Sally, who have really reinforced, acknowledged the evidence of need to really focus on our refugee communities. And I won't, go over evidence already provided, but it really has reinforced the need for this work. So Bendigo Community Health is a large community health centre, and I'm one of the managers of the cultural diversity and settlement programs. And we've been welcoming people of refugee background intensely for the last 10 years. So we think we have around 3,000 to 3,500 people who speak Karen, and we have around 300 to 400 Afghan, mostly Hazara, and a building population of South Sudanese, mostly Dinka speakers, but a smattering of other languages. Yeah.
Great. And I know you said you didn't want to go over what's already been said, but I'm sure you've got plenty of real life examples of the specific barriers that these communities are facing.
So what I was wanting to talk to you about was the why we did what I'm going to explain, what we did and then how we did it, and a little bit of data on reach. Yeah, so I was also part of the 2009 bushfire case management program that many of us were part of as when those atrocities occurred with fire. We've been, as I said, welcoming these communities for 10 years. You know, our Victorian multicultural policy talks about, you know, a fair go for all, a safe and secure place for living. And we are a signatory to the UN Convention, Australia, to welcome and settle our people of refugee background. They come with, as has been mentioned, a history of deprivation, of torture and trauma. That's why they are, you know, refugees. They arrive with having lived a life of deprivation. These three communities have only known civil war for the last 30 to 50 years. So, you know, every person of refugee background has a different backstory, but these three communities have had a life of deprivation. So poor access to education. They come with no public health literacy and immunity that we grow up with, seat belts, you know, fire safety, etc. They have not always been able to learn English. Some of them are not literate in their own language, particularly some of the women from Afghanistan who've been so oppressed, and some of the people from the Karen people that have come from the Thai-Burmese border, who have spent all of their lives in a refugee camp because of the atrocities going on there. So they also have poor digital literacy. And when they come to Australia, when we have the privilege of welcoming them, this is a new environment. So fire in a Thai on the camp in the Thai-Burmese border can look like the fire in the hut made out of leaves is suddenly, someone hasn't watched it, the fire's tracking up the wall of this this hut, and you know, there's an alarm and people beat that out. Now that's their experience of fire. So there's all sorts of good reasons why, you know, they also have not been used to living in a regulated environment. And so simply placing bans on people and total fire bans and so on and so on. So that's why we need to focus. We also know there's an enormous amount of fear, particularly in the last couple of fire seasons. There is evidence of emerging fear, which was exacerbated by the pandemic, I have to say. So, Sally, I might move on to what we did. Over the last couple of years, we've been working very closely with those three communities, the Karen, Dari and Dinka speaking communities. We've developed a team approach within Bendigo Community Health of people of non-refugee lived experience and those other project workers. First of all, we did a scan to see what was available, what was translated, particularly in Canada, who do some good work in this area, and across Australia. We found all sorts of, some translated information, but when we looked at that very closely, the way it was interpreted by our Karen and English readers and Dinka and Dari, you know, it was confusing for them. It was too hard. And in fact, one interpretation was that you can outrun the fire. So there's a lot of big learnings for me, having worked in public and community health for a long time, but don't assume just because someone has translated it that it actually reads accurately and it's easily understood and it's culturally safe. So then we went about looking at fire, flood and heat as the three topics. We worked with our content experts, CFA, SES and emergency preparedness staff at the City Council here. We then co-designed in the true sense useful information, and I did send a couple of examples there, Sally. So there's an example of a Dari piece there that talks about bushfire and heat health. So we really focused on, where do you live? We live in Northern Country. So if you can't read, there are colours and ways of, even with the fire danger rating, you know, they could look at the colours and understand what that meant. The symbol of, you know, total fire ban and so on was very important. Thank you. So that's just an example of one of the fact sheets. We did those fact sheets in those different languages. We also produced a whole range of videos on heat, fire and flood, working with our content experts again to make sure it was right, testing it with community. We always have two people that can speak the language and English to test what we've translated. Even we'll use qualified translators, but when it comes back, they say, no, this is not how we read this. That's a real take-home message. Then we developed a champions program. We engaged 15 champions from those 3 language groups and of various ages and stages. And then they spent time with SES and CFA learning about how to co-present. So we did over about 20 community education sessions this year. It was hampered by COVID, but with about 500 participants. And then the 15 champions went out and had conversations. They weren't responsible. They would, you know, they didn't, we tried to ensure that they didn't feel like it was all on their shoulders. They could ring in and talk to us at any time, but we have some good evaluation data. Those conversations did increase knowledge, and I won't talk about confidence, but it reinforced the fact that we need to do a lot more. The other thing to say about this co-design is Karen as a language is a new language to Australia. So often it's the last to be translated. And if I just look at the census information that's been translated, there's nothing in Karen. So that's another reason why we know that Karen is a new language. We've also set up a Karen telephone hotline that's staffed by Karen staff and backed by health professionals. It's not to be the emergency 000 number. It's for information and clarification. So that work, this is the second year we've done this work and refined what we do. The alarming thing that I want to highlight is that the Victorian emergency app is of little or no use to groups who can't speak English. It's actually frightening, and there's an assumption that everyone can use it. So we really incorporated that in. We started the session often with, and sometimes it was younger people who have some digital literacy. Have you got the app? Let's put it on. Let's show you about the radius. So that with our co-design of information, we with the SES and CFA chose a couple of the key icons and translated those into fact sheets and fridge magnets. So if their app was going off, they could look at the symbol, and at least the symbol, even if they couldn't read the translated text, they would know that they needed to do something. And if they felt that they couldn't read anything, we ensured that they had a friend who spoke that language they could call and say, what does this mean? Where do I need to go? So there's a whole lot of ways that we have been working to build their capacity to understand and to build our capacity to understand what the risk and protective factors are and the enablers and barriers. It was really important with the summer series videos that we produced that we used our very local actors. Some of them, we employ about 10 bicultural staff because they're highly regarded in their communities. And it was done often in conjunction with the CFA in their uniform or the SES. Now, people of refugee background have a fear of authority, and someone in an SES uniform fronting up to your house or a CFA with a whirring noise, you know, they've only known brutality from authorities in their countries. So that's really important.
And Kay, I believe you did some training with the emergency management services as well to increase their sort of understanding of the refugee context. Is that right?
Yes, I did, Sally. The first year we didn't have the capacity. This year I piloted Understanding the Refugee Journey with SES and CFA, and it was a virtual experience. Now that was an experience in itself. A great trial. I really wanted the staff in those, both volunteers and paid staff in those organisations, to understand some of the things that we understand. You know, the different environments they've come from, they've got poor digital literacy, poor English, there's fear of authority, etc., etc. I also wanted to point out, and I want to point out this to other people participating in this forum, our people of refugee background arrive with enormous strength and resilience and drive. So I really want to acknowledge that. Yeah. The CFA and SES were really keen. It really keen. They were highly engaged, and the evaluation data that I've reviewed indicates that there was uptake of knowledge and an intention to look at changing the workforce, to engage some of our people of refugee background as volunteers, and to think about what do we need if we've got to set up a recovery centre where we know there's around 1,500 to 2,000 people of refugee background in clusters, and they sometimes live in clusters. And we've got suburbs here where we know there's clusters. So if it was our suburb in Huntly, which is north, they would need translators, they would need interpreters, they would need signage and so on. So to start thinking about what we would do in the event of a disaster.
Okay, we might have to wrap up there, but it's been so great to have you. I was really so keen to have you share your learning, because I think the work that you've been doing has been absolutely amazing, and I really hope that organisations around Victoria can learn from what you've done. So any last burning things you wanted to mention before we move on?
Two things. Happy to share information, happy to collaborate. I think I'm the only regional presenter. I'm really keen that there's a regional opportunity, working with our refugee communities in looking at, with regard to severe weather impacts. And I am really serious. There's preventable deaths that are going to occur if we don't focus on these very vulnerable but very resilient communities. Thank you, Sally.
Thank you so much, Kay. Thanks for being here. Yeah, that was fantastic. So we're going to have Edgar Caballero up next from Banksia. And Edgar's going to talk about Banksia Guidance Community Services and a couple of programs they've been running that have been having some great results, and also ambitions for the future. Thanks, Edgar.
Thank you, Sally. Yeah, my name is Edgar Caballero, and I work in Banksia Guidance Community Services. I migrated to live, and I am in Wurundjeri Boy Wurrung land. I am constantly learning about country, therefore I acknowledge and respect country, which is the land, the waterways, the sky, the living soil, the animals, plants, the wind and the fire. Country I respect is also family, identity, spirit, language, customs, law, knowledge, nourishment, stories and connection. I respect elders past, present and emerging who are custodians of this traditional knowledge, which has been passed orally, and I'm grateful to be able to learn it. And so my intention to manifest my respect is also through the work we do at Banksia, and I will be showing to you one of it or a couple of them, as it has no other intention but to care for country and its action towards the risk we are facing in this land. And so I'll tell you about the program named CARIA. Next one, please. So we are a non-for-profit, over 40 years. We aim to build social cohesion and reduce social disadvantage. In 2009, we adopted environmental sustainability as one of our organizational values. And since we have launched a few different programs like the grassroots initiative, the Banksia Eco Warriors project. We were facilitators of Resource Smart Schools for local schools. We don't do it anymore. We established a community garden in all 3 of our community neighborhood houses that we coordinate. We installed 25 kilowatts of solar power. Sometimes it gives us more power than what we use. Not always, because clearly we use now more air conditioning, right? And we're also trained with this climate reality, the Al Gore climate change leader program, and we have given many talks about it. Next one, please, Sandra. So our programs are for adults and young people, and with that, we believe we transform lives. And one of our other main values is responding to people's needs. And so we identify the need to respond to deep and old traumas in our community that only reflects in very challenging behaviors, particularly the young people who come to our many programs at Banksia Gardens. That has been our focus for the last 5 years, but now we are able, in the last perhaps couple of years, we've been able to refocus again in the intersections of the environmental crisis, this trauma, and the impact of on our community. Next one, please. So CARIA stands for Climate Adaptation Requires Youth Action. And when I thought of the name, I realized that, you know, it's also part of the scientific name, this name for the hickory and the walnut tree, which also represents a seed that can grow into something majestic. And so we started, next one, please. We started developing this program with the intention of being the intention of calling a diverse group of young people, and remembering that this is in an environment where young people are demanding action from government and organizations to address the emergency. And so we targeted it. It has a journey from a selection process where they even have to present a creative element, have an interview, go to the training. We run an adaptation small project as part of the training, and then at the end we sit down and continue our meetings to create or to just discuss and initiate further actions. Next one, Andrew, please. We did a lot of work in creating our instruction manual and put all these important topics together, as you can see, having very importance on biodiversity, gender equality, the climate justice, racism and First Nations, and all these other programs. And the whole point was making a training rich in educative experiences. So we would be in excursions basically all the time. That was the intention. But of course, we couldn't do it because of lockdown. The next one, Andrew, please. I'll tell you more about that bit. We receive a lot of interest from different places. It was focused to Hume and surrounding councils, but because we were online, we were able to reach far and away, particularly Hume, Moreland, Darwin, and Melbourne City. But also we were able to recruit someone, or just welcome someone from Vietnam who is a student in Melbourne Uni, and lockdown didn't let her come into Melbourne, into Australia. And she's one of our star participants, I should say. Next one, please. So how do you do a very significant experience, meaningful online? That was one of our focus. And so we started sharing acknowledgement of country, which is as I just started. So every time each person would do a different one that it was meaningful to them. We created communal agreements. We created a lot of breakout rooms so people can actually jump in between those rooms and socialize. Next one, please. We create meaning for this light. You saw everyone was holding a candle, and we all share the light of this candle. And we gave all these, what you can read is how we gave sense of it, a sense of purpose. And one says, when I light the candle, I get into headspace to learn about others and with others. It was a shared intention. Next one, please. The game was to find someone who, an environmental and silly game being online, creating cohesion between the group. Silliness does that. Next one, please. Then in December, we were able to graduate. We were able to meet. This picture was the very first time we actually meet each other. Not everyone was there. Anne is on the screen there, logging in from Vietnam. And actually, in 2021, we keep on meeting. And every time we meet, we've been able to do it both ways, online and in person. That's how we run it now. Next one, please. And then finally, we're able to go out and about into our excursions. So we went into a bush tucker walk with Auntie Jo in West Meadows. Next one, please. We went to Nangak Tambori Latrobe Wildlife Sanctuary, learning about biodiversity and indigenous species that they cultivate, and they're very good at doing that. From that, probably Banks Gardens will be a seed bank that we will be collaborating with them. This is next one, please. We went to Altona Beach with Conservation Volunteers Australia, who were partners in here, same as Hume City Council, I should say. And I also failed to say that Victorian Government was who funded this program through this 3CA grant. So we learned about microplastics and others. Next one, please. Probably one of my very favorite excursions was, we rented a group of electric bikes, and we, as an alternative transport, to go from Broadmeadows to Brunswick with our friends at the Eco Justice Hub from the Jesuit Social Services. And in the middle, as you can see, we stopped to check out our bee hotels, and it's part of our citizen science program. Next one, please. And so we learn about zero waste cooking, and we learn about a beautiful place with a permaculture approach. I'm just gonna go ahead, couple of slides, if you don't mind, Andrew. This is now what we're discussing. Few elements that we are still meeting and we are looking to go. And so if you go 2 more ahead, Andrew, please, because I know the time is short, and I just want to show you that we are thinking about a Banksia Gardens heat haven, which will be a refuge place for people experiencing the heat haven. We will transform all the surrounding space around Banksia Gardens, which will include a food forest, and it will include the grassland native space. And just to say that right now, and you probably can see in the picture, the only heat haven spot currently is a huge shopping center and a Bunnings. So it's great, but I believe they produce more heat than what they can relieve. So we're gonna transform this place as a resilient element. And thank you. I think it's the time to finish it.
Thank you so much, Edgar. That was fantastic. Just Andrew, if you wouldn't mind leaving Edgar for just a moment. Edgar, was there anything else you wanted to let us know about the heat havens? Like where are you up to with that at the moment?
Well, yeah, Andrew, if you don't mind going, there's a few pictures, but keep going if you don't mind. I wanted to show you how the space looked like, how the grassland looked like, and how impacted it is by fires of cans, spray cans. And this is what we mean to transform and to make it, if you want to stop over them, we will create a food forest in the surrounding area. We have a lot of car park that creates heat. We want to put well, as part of a community center, it's going to be a climate adaptation hub where we are able to create action plans for the people. And that is, heat plans, just as we've learned how important it is to create these. Obviously in different languages, as our community is quite diverse, improve the healthy of this grassland reserve that we have with the native grasslands that we will be designing with Auntie Jo, as I show you in some of the organizations. And it is a larger revitalization of our housing estate program. So it's looking well, we have high dreams and aspirations, as you say, and we believe we're going to be able to make it happen.
Great. So I didn't realize there was all this vegetation work as well. So will there be both inside and outside components for this?
Yeah, well, look, currently we have community gardens. We are producing compost, which we want to make it with the community. We need to revitalize the soil. The soil there, I don't think is very healthy. We need to test it and then transform it into a place where lots of trees can grow, give us canopy, reduce the temperature, give us a place to do. We have a design of a sustainable playground. So a place for kids when you're gonna find a place to, cool down, kids are gonna be needing to do something, which currently in the shopping center, what do they want?
Yeah.
Something, obviously. If it's a playground that it's helpful for them to interact with this new environment, will be much better, more healthy.
Amazing. Thank you so much, Edgar. So great to hear about initiatives for young people on the younger and older end of that spectrum. That's really fantastic. Thank you so much.
Thank you very much.
So we are going to have a little break now. We're going to break until 11:35. So we've got time to grab a cup of tea, have a little pit stop. If you would like to put some questions in the chat when you come back and you're waiting, feel free. We will come back as a big group before we break out together into our breakout groups. And if you do want to put a question in the chat, just mention who it is that you want to send that question to, if it is somebody in particular. All right, see you at 11:35. Thanks, everyone. So welcome back, everyone. That was such a fantastic bunch of presentations from our panel. Really appreciative that all of them have made the time to share their learnings with us today. And we're going to get a chance now to actually have a bit more of an in-depth chat with them. So Andrew's going to open up some breakout rooms in a moment, and you'll be able to jump into whichever one you want to start with. So we'll have a separate breakout for every speaker. If we do end up with some smaller groups, then we may merge them together, but we'll start off and see how we go, just opening up one breakout room per speaker. So you'll jump in there, and then you'll also have the chance to jump out and join a different room if you feel like there's another conversation that you want to join. Andrew, did you want to throw up that slide about the breakout rooms at all? Thank you for that. Yeah, so in case you haven't seen this before, you will see a little pop-up that'll prompt you to choose a breakout room. If you don't get that, you can just go to the breakout room icon at the bottom of your menu there. And if you're in the middle of a breakout room, you can also use that to enter a different room. So without too much further ado, Andrew, unless there's anything that you want to say, do you want to open up those breakout rooms? Welcome back, everyone. I know for some of you that was quite short, so thanks for bearing with us. Don't forget, we will have a little bit of time towards the end for another kind of networking breakout. So if there were some people there that you really want to keep chatting with, you can find them again. But we're about to go into a slightly more structured breakout now. So this one's going to be around scenario planning, and you'll have the option to choose a breakout that fits a scenario that you're interested in exploring. So we'll be looking at things like heat waves. I think probably a lot of people have done heat wave scenario planning because it's one that we do quite often. But we'll also have a chance to look at bushfires and bushfire smoke, as well as thunderstorm asthma and long-term warming. So less of a kind of shock, more of a long-term stressor. And depending on, I think actually with the number of people that we have, we might only need maybe 5 to 6 groups. So yeah, the aim of this next session is to identify, you know, what kind of impacts this scenario would have on yourself, on your clients or the people that you work with, the community at large, and your organisation, and try to think about how you and your organisation might respond to that, and sort of identify maybe some potential actions to boost your preparedness for the future. So how this is going to work is Andrew's going to throw up some breakout rooms again, and they'll be named for the scenario. So you might want to jump into heatwave or bushfire or a smoky day or hotter summers. And the other thing to keep in mind is that we're going to be imagining that this is happening in some kind of pandemic conditions. So there'll be some kind of restrictions applying, like social distancing, maybe mask wearing. You might, you know, consider what it would be like to do something right now in this current lockdown, or maybe slightly freer restrictions as well. Are there any questions before Andrew opens up the breakout rooms? We will again move you around if need be. If we have some lonely people, we might merge some groups together. All right, go ahead, Andrew. Let's open up the breakout rooms. So hopefully you had a chance to work through your scenario, and just very briefly in the next 5 minutes, it'd be great to hear from one of the facilitators from each room, just maybe one little gem that you want to share from your discussion. Maybe I'll go to Jack first.
We were talking about thunderstorm asthma, which is quite a new conversation for all of us. We were talking about, because of that, it's new for a lot of people, the need for awareness and education campaigns for community to help vulnerable people to understand that these risks, help organisations that provide services be aware of these risks, and to also be aware of kind of government-run alert systems, but also to remember that it might actually trigger anxiety in those who are vulnerable to these issues, and to think about those mental health aspects in those communications and alert systems too.
Yeah, very good. Great, thanks, Jack. I might go to Ellie next.
Hello, we were talking about bushfire, and one of the main points that came up for us was a focus on youth, and sometimes that they get left behind in this discussion, but they do take on a lot of that emotional toll when parents are worrying about where are we going to sleep tonight, what are we going to do with our insurance. They're kind of taking on trying to keep the family happy and together, and especially migrant youth who are usually the ones that have a better grasp on the language and maybe are the ones that have their driver's license, take on a lot of that responsibility in an emergency.
Great, thanks, Ellie. Sushant.
So we merged the group with Ben's group, and we had a really good conversation around long-term heating and some of the different impacts that might have on our community. Speaking for Hume residents, I think particularly those in areas where they're identified as having a large vulnerable community, I think we've definitely recognised that those are the folks that are going to get impacted the most, particularly as the information may not actually get to them. And when we're talking about long-term heating, they may not necessarily be able to access some of the support that council that might provide, such as retrofits, which might require investment from the actual householders. So I think the equity kind of conversation is something that kind of pops into my head. And when it comes to this particular space, I think the uneven impact of climate change is certainly evident in that. More so for vulnerable communities than the general members of our society.
Yeah, great. Thanks, Sushant. I might go to Joe next. Were you in a different group? Yep.
Yeah, I was. We were talking about heat waves. And what sort of came out of our discussion, other than just the usual impacts that we're seeing and hearing about, is that, with a heat wave, people tend to become more reclusive and want to potentially not have many clothes on or be comfortable rather than, being energetic and lively, and that, potentially large community spaces aren't the ideal place for some people to want to shelter. Less life on the streets, so people are sort of hopping between air-conditioned home, air-conditioned cars if they have that ability. So there's less people looking out for others that might be on the street struggling or having difficulties with the heat. And just basically, to be a good neighbour, a lot of the services are affected. A lot of the government and also volunteer services are affected by heat policy, which says they can't go into customers' homes when it's hot. So, looking after and looking out for neighbours and friends close by who you think might be struggling.
Good one. Thanks, Joe. And Heather, were you also in a heatwave group as well? Oh, Heather, you're still muted.
We were together. We combined our groups.
You combined, okay.
But one of the things too, I think we talked about just sharing, having like the aircon clubs where people can go to one person's home where they've got aircon and share it. So you're not sort of having multiple homes and people isolated in their own home.
Yeah, very good. And then I think that group one might have ended up without a facilitator, but I think I saw Edgar and Who else? Well, I saw Edgar for sure.
Yeah, look, we were also chatting about all these possibilities, and you know, we were trying to remember what experience we already have, just to be able to envision what the possibilities will be. And so just considering, who was from IPC Health, I've forgotten his name.
Nurdin.
Yeah, Nurdin, who was giving us a lot of good insight in how people might, you know, like the service of health might be stopped because of how hot it is. I was giving the perspective of how the service of we were giving during the pandemic, we were giving food parcels, we were giving computers for internet connection, all sort of services and referrals that we had in place. You know, all that might be stopped because of the place. And so we were really just wandering around and reflecting on how we need to plan now so we can see some changes within 5, 10 years, or just to say we're ready for the next 5 or 10 years.
Yeah, great, Edgar. Did I miss any groups? I think that was all of them.
Yeah, Georgia.
Georgia?
From Enliven. Yeah, we just had bushfire smoke.
Yes.
Yeah, and we're mainly talking about the impacts on community members, but it also came up industrial fires as well. We did a bit of a tangent, and the prevalence of industrial fires and just bad pollution as well, or poor quality. And also the uncertainty about what is safe and the guidelines of, you know, can I open my car, you know, ventilator while I'm driving, or can I go outside and go in the garden, and guidelines around that, especially in the 2020 bushfires when it was very novel and new and very, you know, claustrophobic feelings of being indoors, and it's even worse than COVID that was mentioned, that you can't even go outside and go for a walk. So yeah, all the many impacts of bushfire smoke and poor air quality in general.
Good one. Thanks so much, Georgia. All right. Thanks, everybody. So the last little session now is just going to be a relatively free-form breakout where you can just reflect on what you've learnt today, get back to some of those people that you met earlier that you wanted to continue a conversation with, maybe do some collaborative planning together, or just make a plan to connect in future. And so Andrew's going to open up some self-selecting breakout rooms again, and we'll come back at 12:25 just to close up for the last 5 minutes. So Andrew, are you ready to open up the breakout rooms? Welcome back, everyone. So thanks very much for sharing your reflections. So it just remains to do a little bit of wrapping up and acknowledging and thanking. Yes, Andrew, thank you for putting that slide up. So I just wanted to acknowledge again that we had some support from the Victorian Government as part of Melbourne's climate journey to do this Exploring Vulnerabilities research, which has kind of given rise to this workshop. And I, of course, particularly wanted to thank, next slide please, Andrew, Liz Turner and Donna Luckman and all of the other people who've been organising the conference, to Ange for being MC, Andrew, of course, for all of your fantastic tech support, Uncle Colin Hunter for the lovely welcome, but most of all to all of you for coming today and sharing your insights. And I want to give a really big thank you to all of the presenters and all of the facilitators. We had a cast of thousands today. We had Ben Latham from VCOSS, Ellie Hall from Banyule, Heather and Georgia from Enliven. We had Jack and Susie from Jesuit Social Services. We had Nurdin from IPC Health. We had Joe Burton and Sushant Gurung from Hume City Council. We had Kay Graves from Bendigo Community Health Services, Edgar Caballero from Banksia Garden. I think I mentioned everybody there. So yeah, thank you everybody who's helped out today. We couldn't have done it without you all. I would like to check whether anybody would like to plug any things that are coming up before I hand over to Ange right at the end. Yes, thank you, Ben. For those of you who missed the launch yesterday, VCOSS has just released some new research. So please go and check that out. Elena's just put something in the chat here about a housing sector forum.
Yeah, it's about housing, but there's a few sessions on the climate emergency and also on affordability. So there's a few intersections that might be of interest.
Yeah, fantastic. And if any of you would like to forward any of this information to me, I'm sure that Liz will help me distribute it. Is that right, Liz?
Yeah, so the slides have now been emailed out to the registered participants. I've also just put in the chat a feedback survey because we would love to get people's views on what they liked about this, the conference. The survey relates to the conference as a whole, but if you've just attended today so far, then you know, just click that you've just attended today and fill it out. And there's also, yeah, we would encourage everyone to join us again tomorrow. So thanks very much, Sally, for a totally awesome session. And thanks to Ange. And
I also just noticed that Karen has asked if we can share contact details. So if anybody wants to share their contact details, could they also give them to you as well, Liz, to share?
Yes, and I'd also invite people, if you wanted to put them in the chat now, if you wanted to make them available for other people to contact you, then that would be fine.
Yep.
But fantastic. You can certainly email me if you want me to distribute your contact details to other people.
Great. All right. Thank you so much, everyone. I'll hand back over to Ange to close.
Thanks so much, Sally. I'd also like to join you in thanking everyone who has participated today. Our opening from Uncle Colin Hunter Jr., Sally in coordinating and pulling that workshop together, an amazing array of presentations and discussions that were had. I know that I certainly learnt a lot in the groups that I participated in. Thanks to Liz for all her work behind the scenes and to Andrew for his IT skills. I also just want to remind everyone, of course, that the conference does continue tomorrow and we are really keen for you to join us if you can. We're really excited to be bringing together a whole bunch of community organisations and emergency service workers tomorrow, as well as a range of traditional owners to share some of their learnings and some of their thoughts about what we can do in terms of strategies and actions to reduce emissions and keep our communities safe in the face of climate change. We will be kicking off tomorrow, as I've mentioned earlier on today, with a special keynote address by Professor Bruce Pascoe. So please don't miss that. If you haven't yet registered, I believe that Andrew will be putting the link into the chat, and I can see he's just done that now. So please do take a moment to register for tomorrow. And as Liz mentioned, please do complete that feedback survey for us. I know that she and some of her council colleagues are very, very keen to get your feedback. And so on behalf of all of the councils involved, all speakers and all panelists, thanks for joining us today. And I hope to see many of you joining us again tomorrow. Thanks, everyone.